SOC Telemed was founded in 2004 by a group of physicians with a vision that high-quality specialty clinical care could be delivered at scale through technology. The mission has always been to provide rapid access to emergency care when patients are at their most vulnerable and time matters, all while improving patient outcomes in a measurable way. In the years since, we've invested heavily in the creation of a robust, scalable telemedicine infrastructure to connect patients with specialists when and where care is needed. We've enabled nearly 850 facilities in 47 states with the technology and expertise to manage complex, acute workflows and to provide timely, high-quality, and in many cases, life-saving care. Today, SOC Telemed is a nationwide leader in the ever-emerging field of acute telemedicine, and our clients include 19 of the 25 largest health systems in the nation. Why have so many healthcare organizations latched on to acute telemedicine? First, let's focus on supply and demand. The U.S. is projected to experience a shortage of as many as 60,300 specialty physicians by 2025, mainly due to population growth, aging, and the fact that more than 2 in 5 active physicians will be at retirement age within the next decade. Rural communities will have it worse, with almost a quarter of Americans living in rural areas and only 9% of physicians practicing there. Next, layer on a multitude of other industry-wide issues such as physician burnout, operational bottlenecks, technology gridlock, and the ever-changing regulatory and compliance landscape. All of these factors cause profound financial pressure for hospitals and directly impact their bottom line. Acute telemedicine has emerged as a solution to create additional clinical capacity, improve clinical quality, and drive operational efficiencies, all creating a path to improve profitability for struggling hospitals. Telemed IQ is our telemedicine technology platform that was purpose-built to virtually deploy our own network of 172 specialty physicians, and now it is available to hospitals and healthcare organizations nationwide to deploy their own clinical networks. Telemed IQ has the flexibility needed to support every organization's unique needs. It can be used for provider-to-patient and provider-to-provider interactions across any clinical specialty, any clinician network, any care location, and on any web-enabled device. It also integrates seamlessly with the client's EMR, delivering consult documentation directly into the patient's medical record. It's how we help providers deploy, optimize, and scale a telemedicine program rapidly and cost-effectively across the care continuum. Using Telemed IQ, we currently offer 3 essential service lines: teleneurology, telepsychiatry, and tele-ICU. The Telemed IQ platform is also used by organizations to support their own clinicians in a wide variety of clinical specialties. To demonstrate the power of our platform, here are a few examples of how Telemed IQ enables the next generation of healthcare. When a patient exhibiting signs of stroke enters the emergency department, the on-site team goes into action. Since strokes cause nearly 2 million brain cells to die each minute, seconds matter. The patient is sent to CT, labs are drawn, and the local hospital staff requests a teleconsult. The assigned teleneurologist reviews the patient's CT images. The telemedicine cart is brought into the patient's room, and the teleneurologist conducts a video evaluation with the patient, family, and local hospital staff. The teleneurologist then makes recommendations, such as administering the clot-busting drug alteplase and/or endovascular surgery. When lives are on the line and time is of the essence, a telemedicine platform like Telemed IQ puts the power of an entire specialist team anywhere in the hospital. Another challenge we're helping hospitals solve is in emergency psychiatry. 1 in 8 patients has a mental health or substance abuse issue. It is common for these patients to arrive at the emergency department in need of care, but EDs are built for medical emergencies, not psychiatric ones. Mental health patients often wait for hours or even days to see a psychiatrist who can help determine whether the patient needs to be admitted or discharged for outpatient care. Our telepsychiatry offering helps patients get the mental care they need, fast, while improving throughput in the facility. Tele-ICU is another area we're proud to support for hospitals and health systems. In many ways, the ICU is the heart of the hospital. It is an intellectually, physically and emotionally challenging environment. Those who specialize in caring for the critically ill understand that providing high-quality care is a team sport. SOC's critical care physicians or intensivists are viewed as a direct extension of that team, providing daily ICU management and 24/7 on-demand support as needed, in the ICU or anywhere else in the hospital. SOC Telemed was born from a vision of technology driving access to rapid, high-quality care in acute care settings. Our Telemed IQ platform empowers us to make the world of healthcare more accessible than ever before by bringing clinicians to patients in need, regardless of geography or proximity. Today, we're proud to help acute care providers and other healthcare organizations across the globe provide access to the right care, whenever and wherever it's needed most.
To have specialists real-time within our hospital, and patients could really stay within the hometown and not have to travel, and that was such an advantage for them.
The ability to use telemedicine broadly is a frontier where I think most healthcare systems are excited to delve into.
Kind of had results beyond what we even expected. If 3 years ago you said this is what it's going to look like, I never would have believed it.
Really understand, people are thinking about this. The leadership teams are thinking about telemedicine.
Love telemedicine. The people that we treat, they are embracing this.
Telemedicine is a demonstrable improvement over what's there today and gives us a great chance to leverage technology to solve some meaningful problems.